Hi, my name is Paul Black. I'm the PGY1 Residency Program Director at the Boise VA Medical Center. I wanted to introduce myself and talk to you a little bit about our residency program. So the schedule for our PGY1 residents, required rotations are ambulatory care, advanced ambulatory care, pharmacoeconomics, inpatient, internal medicine, mental health, and geriatrics. Each resident also gets a 4-week elective, which include, the sky's pretty much limited to that, except we do not have pediatrics, and we don't have specialized units such as, say, a stroke unit or something like that. And then you can repeat any elective required rotation as an elective, or you could do all your electives in a certain area. Like if you like infectious disease, you could do entirely infectious disease. So we try to get people to customize and do rotations in areas they're interested in. Stacking is fairly light. It's 3 days every 4 weeks, Saturday, Sunday, Monday. Projects, the main residency projects are medication use evaluation, which is a year-long project. Again, we try to have you pick an MUE in your area of interest, and a management project. And if I assign those out, and I try to align those with the resident's area of interest if possible. So there's a lot of customization in this residency. Residents that do well in our program are residents that manage their own time well. If you need a lot of structure, we don't provide a lot of structure, and the people that need a lot of structure built in do struggle. But most of the time, I would say our residents are out of here 50 to 60 hours a week, sometimes less if they're really efficient and depending on the rotation. Anyway, I look forward to meeting you. If you would like to contact me, you can email me at paul.black2@va.gov. Thank you.
Hey Brian, what are you up to?
Oh, hey, I'm just working my staffing shift for the weekend.
Oh, very cool. How often do you work that shift?
So we work it every 4 weeks, and it includes a Saturday shift from 10:30 to 4:30, a Sunday shift from 8 o'clock to 4:30, and then a Monday shift from 9 o'clock to 8:30. And what we do is really focus on transitions of care and discharges from the hospital. And we make sure we get a good med rec on the patients that are discharging and make sure they're getting the medications they need when they leave, as well as filling any scripts for the ED and any other clinics that might need any scripts filled. Oh, hold on one second. Hello? Oh, of course. All right, we'll get that filled right away. Well, I better get to work. That was the ED.
Oh, hey Susie, I'm just preparing for my presentation for noon conference today. This is one of our required presentations, and I'll be presenting to the medical residents on antipsychotics and the management of adverse effects. I'm really glad you could join us. Have a seat.
Oh, hey Sammy, I didn't see you there. It's been a pretty busy morning here at AmCare Clinic. I just got an e-consult from a provider asking about anticoagulation bridging. I'm also working up this patient for this afternoon. He has resistant hypertension, so I'm looking into his medication, seeing what interventions I can make. Hi there.
Hey, Dr. Kresge, I have a patient in my office that I'm starting on insulin. Would you be able to provide some insulin education?
Oh, absolutely, doctor. I'll be right there. Well, looks like I gotta head out.
Oh, hey, Kristen. What are you working on?
Oh, hi Sammy. I just got done working up one of my panel patients. I'm going to give him a call right now. Throughout the PGY1 pharmacy residency, we take on panel patients after we're done with our AmCare rotation. And this is typically for chronic disease states such as diabetes or hypertension. And after you see that patient at first in the clinic, you'll then follow up with them until they meet their goals or you lose them to discharge. So it's a great way to get to know your patients and actually see them get to goal.
Hi, I'm Kim. I work in inpatient pharmacy, and I also precept the inpatient rotation. It's a 4-week rotation. It's day shifts, 8 hours, although you do have the opportunity to work a graveyard if you so choose, 1 or 2 shifts, just for fun. You don't have to. We focus on central pharmacy activities, and topic discussions that are associated more with acute critical care concepts. You're expected to attend codes, daily antibiotic stewardship, and your scope of practice includes anticoagulation monitoring and antibiotic monitoring.
Hi, my name is Robin Cruz. I'm one of the preceptors for the ambulatory care rotations for the PGY1s. There are 2 ambulatory care rotations, a 4-week block and an 8-week block. And then if residents choose, they can do an additional elective, which would be another 4 weeks in ambulatory care. The residents get to work in an interdisciplinary primary care team that includes primary care providers, nurses, mental health staff, clerical staff, among others. And the things that the residents get to do include chronic disease state management, whether it's based on consult or maybe a warm handoff, prior authorization drug requests, drug information consults, medication reconciliation, among many other things. Really, the day just depends on what the team needs from the pharmacist that day. The residents also get to pick up a longitudinal panel of patients that they'll carry throughout the year and do follow-up with until the goals of care are met. And one other unique feature of this rotation is that there are often trainees from pharmacy or other disciplines that the resident gets to work alongside and help facilitate their teaching and precepting.
Hi, my name is Sarah Naidu. I'm the Residency Program Director for our PGY2 program in AmCare. I'm also a clinical pharmacy specialist on a PAC team here at the Boise VA. Our PGY2 program hopes to build on the knowledge and the skills that you've gained in your first year of residency. We have you spend 8 months in direct patient care activities. 4 months of those are spent on an interprofessional training team made up of internal medicine residents and students, nurse practitioner residents and students, psychology postdocs, as well as nursing students, residents, and valors. 2 months are spent in Caldwell, which is our rural clinic. Another month is spent in women's health. They also specialize in transgender care there. And another month is spent in ID, focusing on the AmCare side of things. Elective rotations include academia, mental health, pain management, oncology, as well as telehealth. The projects that will have you focusing on include an outcomes-based project, a local criteria for use, as well as an interprofessional QI project. And you do that project with other fellow trainees at the Boise VA. The goal of our PGY2 program is to produce really highly effective ambulatory care pharmacists that can just drop right into any interprofessional team.
Hi everyone, welcome to Silver Team. My name is Shelby and I am one of the PGY2 residents in ambulatory care. I'm currently on my primary care rotation or PACT rotation. Silver Team is comprised of medical residents who alternate in and out each week, nurse practitioner residents, psychology residents, LPNs, RNs, attendings who help the resident staff, and of course a clinical pharmacist. On this rotation, I receive consults for difficult med recs, diabetes, hyperlipidemia, resistant hypertension, as well as other chronic disease states. I am also centrally located on the team, so I'm always available for questions from nurses and providers. This rotation also offers pretty unique experience. Currently, we have a pharmacist-run continuous glucose monitoring clinic where I staff once a week. We also have the very unique opportunity to manage patients with insulin pumps. So typically, insulin pumps are managed by endocrinology, but here at the Boise VA, we have a pharmacist-run insulin pump clinic. So those are just a few of the examples of some of the experiences that you will receive over here on Silver Team. This is a 4-month-long rotation, so you really have time to establish good relationships with other members of the PAC team. I'm just now finishing up my time here on Silver Team, and I've really enjoyed this rotation a lot, and I think it's really allowed me to grow more as a pharmacist in the clinical setting.
Hello, I'm Hillary Dergish and I'm one of the PGY2 ambulatory care pharmacy residents, and right now I'm on my 4-week required women's health rotation, and this rotation is really cool and unique because we not only get to manage the typical chronic disease states, but we also get to manage things like transgender medicine, osteoporosis, and migraine prevention and treatment.
So the Caldwell rotation is one of the required PGY2 rotations for those who are focusing in ambulatory care. So the technical title is the Caldwell CBOC rotation. So CBOC stands for Community-Based Outpatient Clinic. So it's essentially a more rural, small, close-knit version of ambulatory care you do at the Boise VA. And that's really one of the best things about us, that you really get to know the team, you get to know the patients, and you have the 2 months for that continuity of care.
Hi, my name is Kat Smith, and I'm the PGY2 Psychiatric Pharmacy Resident here at the Boise VA, and I'm also this year's Chief Pharmacy Resident. I want to take a minute to highlight the Psychiatric PGY2 here. The thing that is the most special about this is the program's flexibility. There's 6 months of required rotations. There are 3, and they're 8 weeks long. But after you schedule your required rotations, the rest of your residency year is customizable to fit your interests. For instance, I'm focusing my residency year on geriatrics and ambulatory care because I'm most interested in the intersection between AM care and mental health care for an older population. This program has allowed me to spend my project time and my electives specifically on what I want to do with my career. A little bit about the elective rotations available here. There are pain rotations you can take. You can take telehealth rotations in pain and mental health. There's the option to delve a little deeper into any one of the required rotations that interests you. There are 2 required projects for the mental health PGY2. One is a medication use evaluation, and the other is an outcomes project. Additionally, you have the option of taking part in an interdisciplinary quality improvement project. The 3 required rotations for the residency are outpatient psychiatry, where you care for veterans who need mental health care, and you do that in the outpatient setting, and you maintain a panel of patients independently with preceptor oversight. The next rotation is inpatient psychiatry, where you become a member of the inpatient team on our psychiatric ward in the hospital. And then there's residential PTSD and substance use disorder, which sees 2 different kinds of patients. They're residential treatment for substance use disorder and PTSD, and you run groups, you coordinate pharmacotherapy for the veterans. And I hope I've given you a little bit of an overview of our program. It's a special place. The preceptors here care about us, and they want us to have the best training that we can get, and that is clear every single day.
My name is Carl Medeiros Kelly. I'm professor of pharmacy practice within Idaho State University College of Pharmacy. I spend about 80% of my time on site at the Boise VA, where I precept 4th-year pharmacy students and conduct infectious diseases related research. I have a long history of research funding from the NIH, the CDC, AHRQ, and the Department of Veterans Affairs. I am the program director for a VA-funded clinical fellowship specializing in infectious diseases and antimicrobial stewardship. The fellow spends approximately 75 to 80% of their time working on research and quality improvement projects related to antimicrobial stewardship. The remaining time is spent performing antimicrobial stewardship related clinical activities under the direction of our ID clinical pharmacy specialist, as well as limited time mentoring APPE students and delivering ID-related lectures. The VA is a leader in developing robust and innovative antimicrobial stewardship programs. These efforts have been spearheaded by the VA Antimicrobial Stewardship Task Force, or ASTF. I am co-chair of the ASTF Innovations and Metrics Working Group, where we develop VA-wide stewardship-related analyses, and intervention materials for local VA facility adaptation and implementation. The fellow is integrated into these large-scale ASTF projects as well as other locally derived research projects. I work one-on-one with the fellow to help mentor them in designing, executing, analyzing, and disseminating antimicrobial stewardship-related research. Fellows are expected to develop a comprehensive research proposal, lead their own research project, and publish their findings. Prior fellows have co-authored an average of 5 to 6 manuscripts during their training, and several have won national awards for their work. The Boise VA is a very pharmacy-friendly academic medical center, and ample opportunities for collaboration and education exist. This 2-year fellowship prepares individuals to practice in a variety of different settings, including academia, health system level antimicrobial stewardship program management, or other health outcomes, quality improvement, or implementation science related research positions. If you'd like more information about the program, drop me a line or give me a call, and I'd be happy to fill you in further about this opportunity.
Hi, my name is Suzette Ravelski, and I'm the Pharmacy Infectious Disease Fellow at the Boise VA. Just like Dr. Medeiros Kelly had said, I spend a majority of my time doing research here. A couple of research projects that I've worked on is a national quality improvement on outpatient stewardship for urinary tract infections. Other projects that I've worked on are pharyngitis and sinusitis related for clinical outcomes. Also, we've been able to peer review papers for journals such as the American Journal of Hospital Pharmacy, CID, and ICHE. As far as local projects go, we work on establishing our protocol for COVID-19, as well as implementing penicillin skin testing and teaching the new CAP guidelines at the statewide level at a conference. I hope that you consider doing this fellowship, and I love it here at the Boise VA.